Hey guys, in today's video we'll be covering the different types of erythema rashes. Now there's much more than just the 5 that we're going to cover, but these are the most common and the most high yield. So first off, we have erythema multiforme. This is seen in herpes and mycoplasma pneumonia, which is walking pneumonia, and it can be caused by medications such as NSAIDs and penicillins. This rash tends to be symmetrical and itchy, and there's 2 subtypes, minor and major is obviously going to be more severe, including mucosal membranes. Next, we have erythema nodosum. Now, this kind of rash is indicative of systemic disease in the body. So therefore, it's seen in ulcerative colitis, in Crohn's disease, strep pyogenes pharyngitis, which is a hemolytic strep, TB, histoplasmosis infections, which is fungal, and sarcoidosis. This is a painful rash, and it's usually seen in your lower extremities, as you can see in these pictures as well. Now we have erythema migrants. Now this type of rash is specifically seen in Lyme disease. In fact, in the first stage of Lyme disease. It kind of looks like a bullseye. The rash has a small round red center and an outer red part, and it starts out small and grows. And this rash is not going to be itchy or painful. Next up, we have a rash called erythema marginatum, and this is seen in rheumatic fever patients. And remember, that's a complication, a potentially dangerous complication, of having a strep pyogenes infection and not taking the full course of antibiotics to properly treat it. This rash is common in the trunk region and the inner sides of the limbs, and it's not going to be itchy or painful. And it looks kind of like the bullseye rash, but the center red part is much more vast and covers most of the rash. Finally, we can end off with erythema infectiosum. This is a rash classically seen in Fifth's disease, which is a parvovirus B19 infection. It is most commonly seen in children and appears on the cheeks, which is why this rash is known to have a slap cheek appearance. This rash may be itchy.